Hi, so my name is Gabriel Ochoa. I'm a Fall 17 second year PH1 student. My public health problem is smoking. I have a political cartoon here about everyone loves a quitter, and they're all happy because the guy quit, and let's work together to be smoke free. So, my public health problem, why the problem exists? Well, it's very addicting. It's a very addicting habit and hard to quit once you get hooked onto it. Stress relief. Some people like to smoke stress relief and it helps them feel calm. Some people do it to peer pressure because they see their peers doing it, they see their family members doing it, their friends doing it. And some people do it for weight loss. Some people just smoke to lose weight. How it became this way? Usually because people, when they start smoking and they didn't realize how effectful it was to your body and how damaging, by the time they realize it, it's too late because they're too addicted and it's too hard to quit. Tobacco companies spend also $8.37 billion in advertisements annually, which is about $27 per American, trying to convince each American to pick up a cigarette so that they can get more money in their pocket. Free cigarettes to targeted populations is also a big way why this spread because, for example, they gave free cigarettes to the U.S. military and tried to get them to get hooked on, and by the time they got hooked on, they stopped giving them free cigarettes and they wanted to get the money back. So they hooked the U.S. service members on cigarettes. They ended up buying cigarettes because they were too stressed to, originally they were too stressed to be deployed overseas. Public health problem continued. Where it happens mostly in lower socioeconomic communities, African American heavy communities as well. The community risk is death because it's the number one preventable cause of death in the United States, and if this doesn't stop, then the influence keeps spreading, and then more and more community members are going to be dying due to the number one preventable cause of death in the United States, which is smoking. Another big problem is secondhand smoke because they can get inhaled by your pets, your loved ones, infants, children, and it kind of does a little bit of pollution. Etiological factors are, we're talking about African Americans, individuals with family history of smoking, and 10 to 24-year-olds, because that's the golden age when you usually pick up cigarette. Here I have a graph of African American adults, which is wonder where it happens. About more than a quarter of them smoke cigarettes, 8% smoke cigars, smokeless tobacco, 2%. So that's a little around 30%. If it's not overlapping the numbers of African Americans who smoke. So how to solve the public health problem? Strategy 1, educating the public via advertisement. Same way the tobacco companies try to hook individuals on smoking through advertisements, they need to fight back with anti-smoking advertisements. So it's something we've been doing for a while on TV, internet, ads. Includes warning labels on tobacco products and school interventions. In 1965, it was actually a requirement by law to label cigarette boxes with health warnings on tobacco products. And how hazardous it may be, they basically say that this product is maybe a huge hazard to your health. Strategy 2 is restricting access to cigarettes. For example, recently in 2016, the legal age to smoke was raised to 21. So we went from 18 to 21 in California. Other states are following along, such as Oregon, UCI, for example, is a smoke-free campus. All the UCs are. And we're starting to ban smoking in public places. A foreign country, Canada, actually banned smoking in all restaurants and bars in 2006, and shortly after, Ontario, which is one of the counties in Canada, banned smoking in all public places, including casinos. Here's an ad in Ontario where the smoking age is 19, where it says tobacco kills 1 out of every 2 long-term smokers. How to solve the public health problem continued. This is Joe Chemo. He's the smoking camel from the cigarette brands. And at the bottom, it has the Surgeon General's message saying that smoking can be hazardous to your health. Cultural examples actually, France actually prohibits any advertisements or sponsorship related to the tobacco industry. However, it allows cigarettes to still be sold. So basically, it's the same like the United States, except they allow no ads. And those $8.37 billion that are spent in the United States for advertisements, that would be illegal in France. Historical example, Surgeon General released a report that smoking was proven to deteriorate health in 1964, and it was a huge bombshell because nobody actually knew, or it wasn't proven, that cigarettes were bad for you, but Surgeon General released it in 1964, 50 years ago, and ever since it's been the biggest thing any Surgeon General has done, which is release that smoking was bad for you. Public health in the future, we basically need to prevent. Educate the public about the harmful effects not only of smoking, however, being around smokers and secondhand smoke and how dangerous it is. We need to push for legislation similar to France and Canada. Here we have school intervention because 10 to 24-year-olds are most likely to pick up cigarettes, and these are elementary school, middle school, high schoolers, and even university students. So this is what we need to do more of. Intervention at a young age because most people are curious and can be easier influenced at this age. And we need to adapt on educating the public on new forms of smoking, such as e-cigs and the tricks that the tobacco companies have up their sleeves. Personally, I believe that limiting exposure and tobacco advertisements is key. We need to follow France, where we don't allow it, any advertisements or anything, not promoting it, because we're trying to end it. That's where we should go to. We should stop the influence happen, and then we can worry about the smokers who are right now smoking and then quit. I also believe that to buy a cigarette, you should have to sign once a month a contract saying that you know there are programs that can help you, and you know the effects of smoking each cigarette and how it can deteriorate health very significantly. And hopefully that this all can prevent public health issue of smoking in the future. Here are my references. Thank you for listening to my presentation on smoking, and hopefully we can have a more smoke-free environment in the next decade.